So let's start off with today's session. So today I'll be discussing about hospital risk and disaster management. So can anybody contribute like 2 or 3 points about what is hospital? What do you understand by hospital risk?
Ma'am, when nosocomial infections or something is there, fast spreading diseases.
Okay, good. Then anything else? Is it only nosocomial infections or more than that? Anyone from the group? I hope my voice is clear and I'm audible to everybody. Can anybody answer to my question? So I'll repeat the question for you
Yes.
all. What do you understand by hospital risk? Sorry, your voice is not clear. Okay, so let's move on. So today I'll be discussing about your hospital risk and disaster management. In that, unit one, which uh, completely talks about hospital risk, that is nosocomial infections and few other factors that cause infection and that cause complications in people who are admitted in the hospital in 24 hours duration. Whatever happens to the patient rather than the treatment is a risk for a patient. So we'll be discussing about that today. So let's move on to the introduction. Risk is the change that any activity or action could happen and harm you. Risk is direct or indirect loss resulting from inadequate or failed internal processes, people, and systems, or from external events. So, when we talk about hospital risk, it is nothing but a change that takes place whenever no additional complaints are being added to a patient's history. So it can be direct or indirect. So nobody intentionally hurts someone or nothing happens to an individual intentionally. So there are certain causes that contribute or that lead to complications. So the healthcare industry faces unprecedented risks and compounding regulatory compliance requirements. They are particularly vulnerable due to their heavy involvement in patient personal information, time constraints, and nature of day-to-day operations. It means so. As I am talking to you all about hospital risks, so it is completely hospital and patient oriented stuff today. So, generally, whenever we talk about risks, so risk can be mild to severe, can be mild, it can be moderate, it can be severe, and it happens because of the situation, or it can also happen because of negligence. So major factors or major risks uh, that are seen in general are cyber threats, physical attacks, compliance lapse, hospital acquired illness, privacy management, and information security. Sorry. We'll see about each factors in detail. So let's move on to the next segment. So the next one is meaning and importance of hospital risk management. So what actually hospital risks uh, uh, are? Okay, so risk is the chance that any activity or action could happen and harm you. Almost everything we do has an associated risk. It means it is not intentional, but we can predict. For example, a best example that I can give you for hospital risk is people come in with certain kind of disease conditions wherein we know that though we do the surgery, the person will have a minimum amount of risk. Can anybody give me an example of a condition with risk? Yes, anyone from the group can give me an example of a person who walks into a hospital with a disease condition, and the doctor diagnosed him as having a complicated condition, wherein even though in spite of doing surgery, there will be some risk factors. Can you give an example?
Am I
Yes, I'm not able to hear your answer. Okay, I think there is some kind of
cardiac
connectivity
arrest?
issue. Cardiac arrest, and what
Cardiac
are the okay, cardiac arrest, and what are the associated risks?
secondary infections.
Very good. So it's nothing but walking in with a condition, in spite of knowing that the person will land up into one or the other trouble, just to subside and make the patient lead a healthy life for couple of years or couple of months, we take a stand. But the risk is associated with the what do you call that we are taking. Okay, and risk involves uncertainty about the effects, implications of activity with respect to something that humans value. And it's the risks also involve certain kind of effects or implications, wherein by communicating it to the patient priorly will help us to make the patient tackle with the situation. Risk is the likelihood that a person may be harmed or suffers adverse health effects if exposed to a hazard. For example, people with cancer. I can give you a best example wherein when people have cancer, they become very immunocompromised. So there are so many risks if they don't lead a proper lifestyle, or a lifestyle that is prescribed by the doctor. Not only the medication, but as the doctor says, a cancer patient to lead a life without getting exposed to certain hazardous factors that can trigger his immune system and make him more weak. Okay, that is one example that I can give you. And then the level of risk is often categorized upon the potential harm or adverse health effects that the hazard may cause. And whenever there is risk, we should see that we take preventive measures not to complicate it, but make the person come out of that risks in a very easier way. For example, if we do a surgery to a patient, there is risk of infection because of hospital stay, as the patient is exposed to trillions of microorganisms, and the environment is very much what do you call contaminated. And so though we know that the environment is contaminated, we can take steps to prevent infection for the patient, like doing the dressing, means doing often dressings every day, twice doing the dressing based on the surgery of the patient. And also making sure that whenever we go and contact the patient, we wear some PPE, so that we don't cross contaminate infections to a particular patient, so that we are reducing the risks than complicating the condition. Next one is importance of hospital risk management. So basically this hospital risk management is nothing but this is to resolve the threats what the patients have when they stay in the hospital. And there are four major factors that contribute, or four major practices that will help in risk management. They are: conduct risk management facility rounds on a regular basis. If you see, as the technological advancements are happening, and also as the field of medicine is developing day to day, there is so much development in the field of medicine. So so many calls are taken in the hospital, so many changes are there, the protocols are changed, the regulations are changed, manuals are prepared to prevent risk for patients, so that qualitative care is delivered to the patient. So here what happens is risk management plays a major role, because no, there are certain research studies that have proved that people who join in hospitals, means who admit in hospitals with a disease condition, in the 24 hours stay, almost For example, in a hospital, the intake is 300. So 300 bedded hospital. In the 300 bedded hospital, people are coming, they are getting admitted. Among 250 people admitted, 150 of them develop nosocomial infections. So, and also there are not only nosocomial infections, but also there are risk of falls, risk of medication errors, risk of infection, which are caused due to hospital. So the hospital administration and management is taking steps to make sure that patients doesn't fall as prey for infections or risk. So they have planned to organize often rounds. So once in the morning, once in the evening, or in the nights, no, nurses and physicians go for rounds, go and ask the patient about how he's doing, what he's feeling, and identify certain kind of no things which are causing infection or risk for the patient. So they have made it more often so that person is not falling prey for any infection or disease. And also they make sure that every administration no every administrator knows about what the patient needs are, so that he doesn't make the patient fall in a risk. And also ensure staff members who are competent in their assigned jobs, and also training the staffs, making them know how to prevent risks for patient, and also to be keen and vigilant observers so that risk can be prevented prior hand. Make sure there are policies in place to document and assess incidents and near misses. And also it's not only giving a statement that okay, so and so person had risk of fall or had risk of infection, but also making sure you note everything, you document everything, whereas that is a proof. For example, in 1 month there were 8 out of 10 there were 8 nosocomial infections, or 8 out of 10 there was infections at the surgical site. So when you make a document, at least when this hospital administration and management routine rounds or meetings happen, they can formulate certain policies and manuals to reduce the risk, as well as they can train the staff and the other medical fraternity to take measures to save the patients from falling into risks. As part of safety culture and celebrate successes means when changes are made, the risks are reduced. So as a person comes into the hospital, we cannot assure that the person will not develop any other infection, because everybody's immune is different, everybody is unique, and everybody's immune is different. Maybe some can tolerate an unhygienic environment to an extent, but few people, a little exposure can cause greater complications. So it is very much mandatory to identify it prior hand, and also to train the expertise to prevent risks. And once the risks are reduced, it is success for the whole medical fraternity of that particular organization or institution to take more measures and to come up with more ideas to reduce risks. Okay, so this was about the introduction and meaning of hospital risk. I hope I was clear. And if you have any doubts, please you can ask me. Okay, if no doubts and it's clear, I'll proceed to the further slides. So next, let's move on to types of hospital risks. So there are different types of hospital risks that a firm might face and needs to overcome in general. So widely, risk can be divided into 3 types: business risk, non-business risk, financial risk. The healthcare industry faces unprecedented risk and compounding regulatory compliance requirements. So types of hospital risks are categorized into 3: business risk, non-business risk, and financial risk. So this is very much logical. Whatever I spoke to you means whatever I have discussed in the previous slides was about how risks are caused and how we can prevent risk, what is the actual meaning. But now when I'm talking about types of hospital risk, there are 3 major things. As I said you, it's business, non-business, and financial. Can anybody give me for each one of them? It is very much logical. Just think and give me an example. Anybody there?
The financial risk is when patients are less and the hospital will face financial risk.
Okay, so when patients don't walk in into hospital, it is a financial risk. Okay, good. What about business and non-business risk?
When a hospital is not competent enough with other hospital, it
Very
will
good.
also a risk.
Okay, thank you.
Non-business,
Yes, non-businesses.
non-business is when we cannot keep the standards.
Okay.
NAB.
Okay, thank you. Okay, so actually, I'll give you one more example. So it was pretty much clear whatever the examples you have given. So again, a single example that I can give you for business risk is, so though the hospital is competent enough and is running well, has a good what do you call, good name and good popularity, but there are some illegal procedures that happen, and because of that it is at risk. One thing, if it uh, gets exposed, then it is a biggest drawback, and it will cause a greater damage wherein it will not, they'll not be able to recover from it. That is one example. Non-business risk can be, as you said again, so any hospital department, though having connectivity with one another, so what happens there is the quality of care decreases there, and when the quality of care decreases, the intake of patients will also decrease, and certain factors which are not relevant and which are not appropriate for the patients to be treated come into force, wherein that causes a risk. Wherein when we talk about financial risk is not only about patients not walking in, but also it's about the hospitals that are connected to societies or hospitals that run on charity. So if there is any lapse in the budget that has to be released by an authority, if it is not released, then it causes a financial risk. I hope it is clear for you all. And then moving on to the other threats, as I have said you in the introduction slide, the risks of that risks that are caused by hospitals. So the five major risks. So we'll see about that risks in detail. So first one is cyber threats. So what do you understand by cyber threats? An example you can give me about cyber threats. Okay, let's move on. So, cyber threats, the healthcare industry continuously undergoes changes, and new technology is developed and implemented into patient care, facility management, and everyday routines. So, cyber threats are nothing but, so down the line, 20, 30 years back, in the hospitals, registers were maintained, files were maintained, all the documents were handwritten, so no what do you call, typed content. Everything was handwritten, and all the registers, no, different types of registers and files were maintained, and even the case sheets were handwritten from the time of admission to the discharge. But now if you see, the technological advancements have brought a greater change in the field of medicine, and everything is documented in the system. And hard copies are taken and soft copies are maintained. No such kind of thing wherein you have huge and huge of files that are being preserved. So everything is like on the system by using different kind of softwares people are doing it. But there is also a threat wherein cyber crimes happen, and the confidential details of patient are being hacked, and the third parties are easily they are they are able to look into the personal data of patients, which should not happen. So that's where the breach happens. Okay, so primary concerns that people have in the field of medicine is all the records and data that is personally identifiable, and the information whatever has been taken from a patient should only be accessible to the hospital management, but not to the third parties, because it can cause a great damage, and also it can no cause breach, that is problems of confidentiality, wherein people will lack trust in the organization. And also whenever the records get availed by the third parties, it becomes vulnerable, and it can be misutilized for many other purposes, which should not happen. And also history has proven some cyber criminals will hold critical functions for ransom, some will quietly try to steal data, and some just want to cause destruction. So why this cyber criminals do such things is sometimes they want to get some kind of financial uh, stuff from the organization, or else they might have holding grudge on that particular organization, or just for fun some people steal data and try to put the organization into trouble. So easy first steps begin with system awareness and training, incident response plan, certification, and accreditation. So whenever the hospital is launching a new software, or uh, is documenting everything in the system, they should make sure that they take a proper software, and also they are connected to the cyber crime investigators department, so cyber crime department, so that if anything mishappens, immediately the incident is reported, and this crime department people can look into it, so that the breach is not happening and the data is not getting affected. And also whenever a software is taken, or a software is uploaded into the system, make sure that it is a certified and an accredited software, which will not cause breaching of data. And also the experts or the nurses, the physicians should be trained about how to secure and save the documents. That was about cyber threats. And the second one is physical attacks. Increasingly physical threats are growing, and even healthcare facilities are not immune to the threat. In fact, a study shows that hospitals are twice as likely to experience physical attack incident as a cyber attack or breach. So the physical attack rates are more in the field of healthcare, and also there are certain threats to the department people because of the data issues, or because patients are not happy with the qualitative with the care that is being provided. And easy initial steps which can help to prevent this physical acts are proper security, proper system to approach patients, proper way of communication, and also certain people who are very much anxious or have some psychological or the psychiatric disabilities. So a buzzing system should be there. So whenever there is threat, the medical team can use that buzzer, so that security can come and help them out than causing any destruction over there. And also if people who are very much aggressive, a certain kind of badges, or certain kind of tape, badge tape can be given to the patient, or a kind of identification mark can be put on the bedside, or a mark on the care sheet, or letting all the staff members know about that particular patient, because before going into contact, people can be little cautious about the patient's condition. And also making sure physical attacks are not only that, and also making sure that people don't carry any kind of stuff to attack people. Okay. And then intrusion detection systems, security lighting, and video surveillance are easy steps to contribute a safer environment. Not only this tapes, the buzzing system or etc., but also there should be proper CC surveillance, and also proper lightning, and availability of people who can help uh, to know come and save you from such kind of scenarios or situations. Third one is compliance labs. Compliance labs is today's healthcare regulatory environment more complex than ever, putting facilities at higher risk and non-compliance. Healthcare organizations or providers needed to be fully aware of all laws and regulations that apply to them. These can be included HIPAA, high-tech patient care, billing, etc. So in a nutshell, if I have to tell you about compliance labs is nothing but giving some kind of support to the patient. For example, if a person comes with a critical disease condition or a dreadful disease condition, so what uh, the financial status of the patient is very much low, so he needs treatment at the first hand, but this financial crisis is stopping him. So this HIPAA comes into force, which is called as hospital insurance, portable and accessible to the patient. Sorry, probability and accessibility. Hospital insurance, probability and accessibility, wherein the social workers who are present in the hospital will help the patients to fill that particular financial gap and get a proper treatment. And this compliance labs is not only about that, but also the qualitative care that has to be delivered to the patient, and to make sure that whenever the person admits and discharge, a proper billing should be done, so that they don't run into loss, nor the hospital nor the patient. And also it should be risk free for the patients. No Whenever the patient gives feedback about the type of care provided, or no the information given, so it should be a fully satisfactory level of what do you call feedback from the patient. Next, the fourth one is healthcare illness. Healthcare illness, it is not difficult to imagine that one of the greatest risk of healthcare facilities is contagious illness and germs affecting both staff and patient. So healthcare illness is nothing but, the first point states, cross contamination. Infection can be from patient to the medical staff, or from the staff to the patient. So unnecessary exposure to bacteria or virus should be controlled. And also patient should be secured in such a way that he is not getting exposed to factors that cause infection. So any medical or surgical conditions, we have to make sure that we don't cross contaminate infections to patient, as well as patient is in a safer environment. According to the study, 1 out of 25 patients get an infection due to their hospital care, which leads to the loss of 10,000 of lives and cost of healthcare system billions of dollars each year. So it's like every hospital you take, so there are number of hospitals across the globe. So across the globe, how many ever are treated? Among 25 patients, one develops an infection, and due to that, there is 10,000 of lives being lost. And also the loss is not only of patient or patient's family, but also for the medical fraternity, as no, the health system uh, has a loss of billions of dollars every year. Okay, so as of now, we have discussed about four major risks. First one was cyber threat, second one was physical attacks, third one was compliance labs, and fourth one is healthcare illness. So I hope I was clear till now. So if you have any doubts, you can ask me. Otherwise, I'll proceed with the next slide. Okay, so moving on to the next slide, which is the fifth major risk factor associated to hospital risks, that is privacy management and information security. So this plays a major role because there should not be vulnerability of data. And if privacy is not maintained, it means the process of breach takes place and people lose trust. They don't no wish to continue their treatment. So with companies still settling into GDPR, that is the General Data Protection Regulation, force changes in operation, which ripples and makes way across the country as privacy becomes the focal point. So uh, nobody likes discussing about what they are going through. For example, a person with HIV/AIDS doesn't want his condition to become a hot topic before everybody. Yes, people are open minded now, but still people have stigma about HIV/AIDS when we talk about HIV and AIDS. So privacy plays a prominent role not only for people with HIV or AIDS, any kind of health condition they come up with. They don't want people to discuss. Discussing it with medical fraternity is only a big problem for patients nowadays. But because they need help from them to stabilize themselves, they come to doctors and nurses and open up, tell about their health condition and get proper treatment done and go. But when the privacy is breached, they lack trust and they don't want to continue their treatment, not only in the hospital where they had faced the situation, but also from anywhere else. Okay, managing all users and data is a challenge that not everyone is prepared to adapt to, simply because they lack the resources to implement such a change. So though there are measures that can be taken to provide good privacy to the patient, or or to uh, uh, give a trust of confidentiality to patients, but situations demand so wherein breach happens all the time. The struggle is and will continue to be finding the right balance between security and streamlining the healthcare processes. Now many people try to balance between confidentiality and uh, you know um securing the information whatever is given by patient. But because of the time constraints and because of the situation, it happens to be so wherein you have to discuss it with multiple people to find the proper solution. If you are not discussing it with people, again, uh, one globe can cause a biggest complication. But it is mandatory that if privacy is maintained, it helps in bringing up the trust of patients, and also it helps in gaining lot more information about what the patient is going through. So that was about five threats. And next one is cross infection. So cross infection concept and modes of transmission. So a cross infection is defined as the transfer of toxic microorganisms, usually bacteria and viruses. The spread of infection can occur between people, pieces of equipment, or within the body. So cross infection is nothing but it is because of toxic microorganisms like bacteria and viruses. The infection can spread in any way. It can be between people, it can be because of the equipments used, it can be within the body, or it can be because of the environment. A cross infection occurs when harmful microorganisms like bacteria and viruses transfer to a patient through another person or medical tools or equipment. The same explanation. And then it can also spread within the person's body. Such an infection can acutely delay wound healing and lead to more serious complication. So if the immune is compromised, then the rate of infection increases. So when such thing happens, the process of wound healing delays. So if a person had undergone a surgery, if a person has undergone a surgery, so and he is not on a proper diet, he's not taking his medication properly, obviously his immune gets compromised. And once his immune compromised means there is risk of infection. And if the infection increases, the process of wound healing decreases, and also there can be so many other serious complications. So when this cross infection occurs in a hospital or long-term care facility, it is called as nosocomial infection. So any kind of cross infection from people to people or from uh, the equipment used or within the body. So during the stay in the hospital, 24-hour stay, if it is happening, it is called as a nosocomial infection, or it can also be because of the long duration of stay in the hospital which causes nosocomial infection. So I hope you all know about what is nosocomial infection. Again, to make it clear, nosocomial infections are nothing but hospital acquired infections, and this usually take place during the 24-hour stay. Okay, so next let's move on to modes of transmission of cross infection. So modes of transmission is through bacteria, fungi, parasites, and viruses. So these microorganisms can be transmitted through unsterile medical equipment, coughing and sneezing, human contact, touching contaminated objects, dirty bedding, prolonged use of catheters, tubes or intravenous lines, and insecure wound dressings can also leave the affected area vulnerable to cross infection. So majorly cross infection is caused by bacteria, parasites, virus, and fungi. And these microorganisms are transmitted when the equipments are not sterile, when person has flu or cough or has cold, and it can also be from person to person, as I said priorly, and it can be through touching contaminated objects and etc., which is very much self-explanatory. Next one is risk assessment at hospitals. Risk assessment is the process of identifying the hazards currently exist or may appear in the workplace. Risk assessment is the combined process of risk analysis and risk evaluation. So uh, before starting the class, I have discussed about what is risk, what is hospital risk, how you will analyze risk, and no, when we talk about it, risk assessment is nothing but it is a combination of analysis and evaluation. So I know, so I am giving you an example that I know that one patient who has walked into my hospital has to undergo a surgery, and once he undergoes the surgery, there is a minimal risk of developing infection. So I analyze the situation, and I tell him that you are at risk of infection. In spite of doing the surgery, you will have 20% of risk of developing infection, and that risk can be what you call subsided by taking certain kind of measures. Means I'm assuring the patient, I'm doing the risk assessment priorly, and I'm assuring the patient that though you will have the risk, I will rectify the risk by giving you a proper qualitative care. And then risk analysis is the process of determining how often specified events may occur and the magnitude of the consequences. Risk analysis is also a process wherein it's about knowing that risk is there, to which extent it will come, and what will be the consequence of it. Okay, and then risk evaluation is the process used to determine risk management priorities by comparing the level of risk against predetermined standards, target risk levels, or other criteria. To generate a prioritized list of risk levels or other criteria, to generate a prioritized list of for risk for further monitoring and mitigation. So in a nutshell, if I have to tell you about what is risk assessment at hospital, it means risk analysis and risk evaluation. Risk analysis is you are predicting what will happen to your patient, and this prediction, how you will rectify it, is risk evaluation. So as I gave you an example, I have already I have got a patient who has to undergo a surgery, but who is at minimal risk of developing infection. So I analyze it, I tell to him that you are at risk of developing infection in spite of getting your surgery done, and this risk, whatever 20% chances of risk is there, I will evaluate it by giving a proper treatment and make sure that you become hale and healthy and walk out of the hospital, so that it gives confidence to the patient, and also he'll be ready to accept the treatment or the task whatever you are going to take up, or the decision whatever you are going to take. Next one is the continuation of it. Based on the risk assessment, an annual plan of action should be charted out at the end of the current year and ratified by HICC. HICC is nothing but Hospital Infection Control Committee. So based on the risk assessment, a plan should be done. As I said previously, recording of the risks. So in a month, if there were 10 scenarios of risk for so in a unit, if there were 10 people who had risk of falls or 10 people who had risk of infection, you are documenting it and you are discussing it with the hospital administration and management. And then what happens is you will get to know the solution to avoid further risks and complications. In the same way, the annual plan, risk assessment annual plan, will also help you to forego or to prevent the future risks that will happen to the patient. For example, again I'm giving you the same scenario over here. I said that one patient who has undergone a surgery has 20% chance of developing infection. So I got to know that a person who had an appendectomy has 20% chance of developing infection in his stay of hospital. I make sure that the second case which comes, I don't make him land up into the same problem again by taking measures to prevent the risk. Understanding. And then the risk assessment procedure comprises of the five major steps or five categories. So they are: step one, identify hazards, means anything that may cause harm. Employers have a duty to assess the health and safety risks faced by their workers. Employers must systematically check for possible physical, mental, chemical, and biological hazards. So anything that causes harm should be kept away from the patient, so that patient is not at risk as well as the employer is not at risk. So there are four major categories in this. They are physical, mental, chemical, biological. So physical hazard is shifting of the patient, lifting of the patient, changing of position, slips, fall, noise, uh, machinery, dust, computer equipment, etc. Whereas the mental hazards are excess workload, long hours, working with high need clients, bullying. It means it's not only means when I'm talking about physical, mental, chemical, biological hazards, it is for both staff and patient. For staff, it will make them land up into one or the other problem that they have to be answerable to the management, whereas the patient will also land up into the problem wherein again the type of treatment being provided varies. Okay. And then moving on to the chemical hazards, that is asbestos, cleaning fluids, aerosols, and biological hazards including TB, hepatitis, and other infectious disease faced by health workers, home care staff, and other healthcare professionals. So the risk assessment at hospital, uh, first step is identifying the hazards, which are basically four types, that is physical, mental, chemical, and biological. Next is step two, decide decide who may be harmed and how. So decide who may be harmed and how talks about employers must review work routines in all the different locations and situations where their staff are employed. For example, home care supervisors must take due account of their client's personal safety in the home and ensure safe working and lifting arrangements for their own home care staff. So employers who have busy scheduled routines or work in different areas, they have to make sure that they know about everything and they know about what are the safety measures they have to take. They have to know that what risks the patient will have, and priorly they have to do all the arrangements that can help them to prevent risk for them as well as for the patients. And then moving on to step 3, which is assess the risk and take action. This means prior handed whatever the patient is going to land up into, assessing for the type of risk, and providing 3 types of care, that is primary, secondary, and tertiary level of care. So in the primary level of care, what happens is you are analyzing that yes, this particular person will fall in the category of mild risk or moderate risk, and you try to rectify that risk. Second one is secondary. If the person is in the risk, means has fallen into the risk, you will see to it that it doesn't get complicated. And the third one is tertiary. Tertiary level of care or tertiary level of risk is the person has already landed up in the risk and is in a complicated situation. Now you have to make sure that without complicating it much, or without making a person die, or person developing much more infections or anything, you will see to it you rectify it by bringing it to uh, a moderate level, not completely curing or not completely complicating, but bringing it to a moderate level and stabilizing the patient. Next, moving on to step 4, that is make a record of the findings. So whatever happens in the organization or institution at the hospital settings, the staff has to record, document it, so that it can be discussed with the administration and management to prevent further risk, or to prevent further outbreaks, and to completely eliminate the risk and prevent the risk. And also this record and documentation will be a proof of what happened priorly and what should not be happened. It's not only about one staff taking care, because multiple staffs come, every shift staffs change. There will be staffs who will freshly join, so it should be accessible to everybody, it should be known to everybody, so that patients don't fall as prey. Next is step 5, review the risk assessment. So first thing is you will analyze, evaluate, but still if the person is falling into risk, you will try to give 3 types of care: primary, secondary and tertiary care, to resolve the problem. And you will document everything, you will keep it securely, and make all your staff and the medical fraternity know about it, so that further harm can be reduced. And also you will make a review of this. For example, in 1 month, so this will be my first month as a staff nurse, and I have documented that there were 25 risks among 50 patients. After jotting down all this 25 risk, I go to the committee people or the administration and management, I discuss about it, they give me some solutions. With that better solutions, I try to apply and prevent risk, wherein this 25 out of 50 becomes 19 or 18 out of 50. Means when I go for a review, I'm making sure that the risks are being reduced and the patients are also satisfied by the care that is being provided. Hence, the goal that is set is achieved and the demands of the patients are cleared. Next, this was about the 5 steps, that is analyzing, evaluation, recording and reporting, and reviewing. Okay, so this was about the uh, risks of hospital or hospital associated risks. So let's move on to the second topic of it, that is nosocomial infections. So priorly I said you nosocomial infections are nothing but hospital acquired infections. So the term nosocomial infections comes from a Greek word, that is nosis, meaning disease, plus comion, meaning to take care of. Hence, nosocomials should apply to any disease contracted by a patient while under medical care. So, any kind of infection or disease which happens to a patient when he is under medical care is called as nosocomial infection. Nosocomial infections are infections that have been caught in a hospital and are potentially caused by organisms that are resistant to antibiotics. Though the person is on medication, he is given deliberate care, but still he is developing infection. It is because the bacteria or the virus or any microbial agent is resistant to antibiotics and causing infection. So the nosocomial infection is means it doesn't have a known cause, it can be any cause, and the bacteria is antibiotic resistant bacteria. or virus or fungi. A nosocomial infection is specifically one that was not present or incubating prior to patients being admitted to the hospital, but occurring within 72 hours after admitting in an hospital. So please remember this thing. A nosocomial infection is not carried in the patient when he is admitting into the hospital. It is after admission, that too after 72 hours of admission, the person shows up a newer kind of infection, which is considered as nosocomial infection. Then forms of infection. So forms of infection are of four types. First one is endogenous. Second one is cross contamination, and yeah, okay. So it's of two types, that is endogenous infection and cross contamination. So endogenous infection is nothing but self infection or auto infection. It can be due to not taking medication properly, not taking diet properly. Already the person has undergone a surgery. He has to take medicines or medication on time. He has to take nutritive diet. But when he doesn't take it, his immune get compromised, and he gives a very greater chance for the infections to start develop. That is endogenous. And whereas cross contamination is nothing but it can happen from person to person, or whenever the person comes in contact with ineffective agents or contaminated agents. Next, moving on to prevalence of nosocomial infections. So 7% to 10% of nosocomial infections are observed in developing countries, and these infections occur during hospital stay. They cause prolonged stay, disability, and economic burden. Of every 100 hospitalized patients, 7 in developed and 10 in developing countries can acquire one of the healthcare associated infections. Hospital waste serves as a potential source of pathogens, and about 20 to 25% of hospital waste is termed as hazardous. So, again, I'm repeating, 7% to 10% of nosocomial infections are seen in the hospitals in developing countries. It is because of duration, means longer stay in the hospitals, or it is because of disability or economic burden. And of every 100 hospitalized patients, 10 people develop this healthcare associated infections. And not only the environment but also the waste generated from hospital also causes 20 to 25% of chances of developing infection. Nosocomial infections can be controlled by practicing infection control program, keep check on antimicrobial use and its resistance, adopting antibiotic control policy. So when the physician gets to know that the person is at risk of developing infection, he should make sure that he gives him the antibiotics that can kill any kind of bacteria or uh, virus. And also he has to vigilantly keep check on the antimicrobial agents that cause infection to that particular person. Next one is epidemiology of nosocomial infections. So when we talk about epidemiology, it is nothing but what is the scenario? How many cases are there? What is the current scenario of nosocomial infections? So nosocomial infection affects a huge number of patients globally, elevating mortality rate and financial losses significantly. According to an estimate reported of WHO, approximately 15% of all hospitalized patients suffer from these infections. These infections are responsible for 4 to 56% of death causes in neonates, with incidence rate of 75% in Southeast Asia and Sub-Saharan Africa. So most of the nosocomial diseases have affected neonates because of their low immunity or immunocompromised state. Risk factors determining nosocomial infections depend upon the environment in which care is being delivered. And it also, a nosocomial infection is not only due to the stay, it is also because of the type of care that is being delivered. If for dressing, if they are not following proper sterile techniques or aseptic techniques, if they are not following, ultimately the person is going to land up in one or the other infection because of the contaminated equipments and contaminated uh, what you call solutions or kit, whatever they are using. And it also can be a cross contamination from a medical fraternity to the patient if they don't do proper hand washing before and after dealing with patients. Next one is hospital infection control procedure. So this hospital infection control procedure is actually the task which is taken up by IPC, that is Infection Prevention and Control Program Committee. So this Infection Prevention and Control Program Committee, they completely work on seeing the well-being and safety of patients and their families, health workers and the community. And this IPC is the head, so this IPC works with the collaboration, works in the collaboration with HICC, that is Hospital Infection Control Committee. So both of them make certain protocols, and they also train the staffs of particular hospital or any kind of institution or organization to eliminate the risks that are caused by contaminated or hazardous materials. Okay, the HICC is an integral component of the IPC program, and the healthcare providers and the healthcare fraternity, whoever comes in contact with this IPC and HICC, they completely work for the well-being and safety of patients, healthcare workers, patients' families, so that there is no threat that is caused by hospital to people. The IPC manual at the facility level should be developed by the IPC team based on the IPC policy with inputs for the relevant departments, followed by review of approval by the HICC. This IPC gets approval from HICC after formulating certain manuals or protocols, because both of them collab and work together. They make sure that threats are minimized or threats are prevented. The IPC manual should be widely distributed in the HCF and should be available in all relevant areas. So HCF is nothing but the healthcare fraternity. The healthcare providers, the healthcare fraternity should know. So IPC, HICC is a committee. They will come to different organizations, the different hospital settings. They will come educate, let people know about the threats of risk, threats of hazardous material, the threats of hospital associated infections, and they will train the staff, train the medical fraternity to prevent risks. They'll conduct certain kind of workshops or conferences and train the whole hospital management regarding no hospital associated infections, so that the risks are reduced. The IPC manual should include certain kind of protocols, policies, guidelines, and recommendations. And this IPC is a two-tiered system which completely focuses on standard precaution, transmission based precaution. Standard precaution is nothing but maintaining aseptic techniques and maintaining high sterilization techniques in the ICUs and OTs, whereas transmission based precaution is when the person is transferred from ICU to the general wards, making sure that cross contamination doesn't happen and the person is not exposed to highly contaminated environment. So again, I'm repeating about this two-tiered approach. It is standard precaution and transmission based precaution. Standard precaution is nothing but maintaining high sterilization and what we call uh, high level of uh, aseptic techniques that we have to take to omit or to omit the uh, uh, risks that are caused. And also the transmission based precaution is nothing but uh, when the person is transferred from a high sterility zone, that is from the ICUs and OTs to general ward, we should make sure that uh, the cross contamination doesn't happen and the person is not exposed to an infectious environment. So if you remember in the first slides, I have discussed about microorganisms that cause infection and how this microorganism cause, for example, by untidy bedding, by contaminated equipments, by cross contamination from person to person, or not maintaining a proper hygiene. So that's how this transmission based precaution can be prevented. So this is the two tiered approach. Then moving on to the next slide, that is high risk procedures in hospital. So when we talk about high risk procedures in hospital, just a minute, I have some kind of issue in displaying my slides. Yeah. So hospital risk procedures in hospitals. So the example is use of indwelling catheters and other devices. Surgery and other invasive procedures are mostly performed in special settings like OTs, ICU, neonatal wards, hemodialysis units. 5 main infection control manuals to control transmission. So high risk procedures which are performed in the OTs, ICUs can uh, prevent the risk, means we can prevent the risk for the patient by following this 5 manuals. This 5 manuals will help in preventing the risks after the surgery or after any procedure done for the patient in ICU or OTs. So what are that 5 infection control manuals? First one is hand hygiene. So washing the hands thoroughly by using all the 7 steps of hand washing. Second one is PPE. PPE includes all the personal protective equipments, including the hair cap, the head cap and goggles, mask, and depending on the condition of the patient, whether it is double masking or double gloving, it depends. But PPE is mandatory. Isolation whenever and wherever it is required, proper handling and decontamination of patient care equipment, proper handling of patient care environment. So high risk procedures which are performed in the ICUs and OTs also need high care, safe environment, or a highly safe environment, so that the person is not exposed to any kind of infection. So that's the reason these 5 manuals play an important role. If a proper hand hygiene is maintained, proper use of PPE is done, isolation is done, and whenever you come in contact with the patient in delivering care, if you are using the equipments properly, sterile equipments, not the contaminated ones, and also the environment, if you are putting it safer, the person will not land up into any complications. Next is the general principles that have to be followed in high risk areas are special procedure for special procedures, highly sanitized area, and also the standard precaution techniques. Standard precaution techniques are nothing but, as I said you again, ICUs, OTs are very sterile zones. From there, when we are transferring a patient, or from when we are doing a procedure in the ICUs and OT, we should see that we follow all the aseptic techniques, and also PPE. PPE is nothing but the personal protective equipments. And the staff and the doctors in the high risk areas should actively liaise with the infection control department in monitoring, reporting, and analyzing infections. So making sure that it is not OTs and ICUs are not contaminated by the external factors. Some of the high risk areas are ICUs, OTs, labor rooms, emergency medical units, CSSD, laboratories, blood bank, dental clinic, transplantation units. Whereas surveillance of high risk areas are hospital acquired infection, which is monitored in the what you call the transplant areas, wherever the transplantations are done, and also analyzing the bed sores when people are in ICUs for a long period of time, uh, unconscious or semi-conscious patients who cannot independently move or change position. Bed sore analysis to be done for them. Needle stick injuries, multi-drug and resistant organisms, environmental surveillance. So surveillance is nothing but keeping a check on hospital acquired infections, keeping a check on bed sore analysis, keeping a check on needle stick injuries, and also making sure that the person's immunity is not compromised, because if the person's immunity gets compromised, antibiotics will no longer work for him, and then the whole treatment regimen has to be changed. Next, moving on to the role of service departments in the control of hospital infection. So service departments in hospitals like outpatient department, FNB, CSSD, laundry and linen services, pharmacy, housekeeping and sanitation, engineering maintenance departments need special attention of hospital management towards prevention and control of nosocomial infection, because these are the sources from where the person can get infection. If the food is not delivered, or sorry, if a food is not prepared properly, if it is not made under hygienic conditions, then the patient falls as prey for infection and disease. If CSSD means the sterilization unit in the hospital doesn't sterilize the equipments at a proper temperature, then again the person lands up into complication when that articles are used in providing care for the patient. And then laundry and linen services, if the laundry is not done properly, rate of infection increases. The pharmacy, proper medications are not delivered, medication errors can cause complications in person. And then in the same way, housekeeping, engineering departments, everything should be highly monitored by the hospital management so that infections are prevented. Keeping in view the magnitude of hospital infections, interventions at various levels are required to eliminate or minimize the problem. Healthcare workers sometimes acts as vectors of disease, disseminating new infection among their unsuspecting client. So, however, no, the medical fraternity or the staff, the physician tries not to cross infect the person, but at certain situations, things happen to be so wherein we become the first channel, being a staff or being a physician coming on approach with the patient, we become the primary source of contaminating or infecting the people. So much attention is required uh, when we come in contact with people who need a proper sterile or a proper hygienic care. Next, measures to be adopted by healthcare providers to prevent nosocomial infections. Again, the same thing I'm telling you. PPA is very much mandatory to rule out the infections, to prevent the infections, and also to make sure that the patient is not falling into risk or not developing any kind of complications. So hand washing is very much needed. And as we all know, after COVID, everybody has become cautious that no, they carry sanitizers. They make sure that they use hand rubs to sanitize their hands so that they are not getting infected or they are not cross infecting people. And stethoscope. So whenever the physician or the staff uses stethoscope, it is very much mandatory to clean the stethoscope with this antimicrobial rub, and when using it from one person to another, because it also acts as a source of spreading infection from one patient to another. Using of gloves and changing of gloves whenever you change from one patient to another. Seeing the no what you call keeping a check on intravenous catheters, not allowing the patient to have an intravenous catheter for a long period of time or for longer days, making sure you change it if it is needed, or else after the treatment you try to remove it. And then using of mask whenever you come in contact with people or patients during the care, or whenever you are in the unit providing care to multiple people. Gowning procedure, not only no, it's not mandatory to use, means wear a gown every time when you are going and talking to patients in units, but it is mandatory when you do some sterile procedures. And then white coats are nothing but a great agents of transmitting or a great agents in cross contaminating people from one person to another. So making sure that whatever or whichever day you're exposed to the patients, make sure that you do not reuse it, wherein you wash it, make it exposed to sunlight, and then come up the next day with the newer one. No, so that whatever the infections that you have carried are vanishing and not cross contaminating people. And then again, the intravenous catheter, it is not only about the venflons, that is cannulas, but also any kind of tubings. Make sure that they are in place and they are not for a longer time, so that you often change it and make sure the person is not getting contaminated. Then when we talk about preventing the risks, hospital risks, there are certain universal precautions that have to be taken. So whatever I have discussed in the previous slides, the same thing applies here. It's nothing but using of PPE, making sure that there is no cross contamination, there is no contamination of the equipment that we are using, and the environment is under control when we are giving care to the patient. And also keeping a check on the patient, not leaving the patient alone, always assisting the patient or keeping somebody to monitor the patient. Then moving on to the role of hospital administration in infection control. So to tell you about the role of hospital administration in infection control, in a very simple way, if I have to tell you, it is nothing but whatever risks that we find out when we are providing care to the patient, we have to record and document it, bring it to the management or the administrators, so that they can look into it and they will come up with the solutions and train the healthcare workers to avoid it further. This is as simple as I can tell you about uh, role of hospital administrator. And then moving on to the last slide, that is infection control program. So the role of administrator in infection control program is assessing roles and responsibilities for infection control throughout the hospital with clear lines of accountability and delegation. So they have to make often rounds to every unit to make sure that everything is hygienic, the environment is clear, patients are not getting affected. Establishing multidisciplinary infection control committee, ensuring education and training of all staff nurses through support of programs on prevention of infection. Whatever is documented, when you bring it to the administrators and management, they come up with the solution and they come and teach your particular organization or institute staff and the medical people, so that everybody will be aware of not doing the same mistake again and again. Delegating technical aspects of hospital hygiene to the staff especially, and also periodically reviewing the status of nosocomial infections and effectiveness of intervention. So whatever reviews, whatever solutions the the administration has come up with, they should also see to it and review it and form new protocols, new regulations, and new manuals, so that the whole staff and medical fraternity is aware of it, and will also help them to prevent furthermore complications in the while providing care to the patients. Then reviewing, approving, and implementing policies approved by the ICC. So ICC is nothing but the internal committee of hospitals that especially concentrate on infection control committee, so which actually focuses on implementing the newer protocols, reviewing the newer protocols, and resolving the flaws that happened before. And then participating in outbreak investigation. Participating in outbreak investigation is anytime any risk happens, the whole administrative committee or the department people, the heads of administration and the management department should come and look into the risk happened, wherever the risk happened or the disaster happened, so that they can know about the level of risk that has been taken, whether it is mild, moderate, or severe, and accordingly they can ask their staff to do the needed arrangements, so that the person completely falls out of the risk. So this was about your unit 1, hospital risks and nosocomial infections. I hope I was clear. If you have any doubts, you can ask me right now. So I will summarize the whole unit for you all once again. So we have started with discussion with the discussion of what are the risks that are caused in the hospital, what is the actual meaning of hospital risk, and what is the importance of hospital risk management. And then we have seen about types of hospital risks, and all these five sorry, all these five major risks, that is cyber risk, physical attacks, and compliance labs, healthcare illness, and privacy management, we have seen in detail. And then we have also seen about cross infection, modes of transmission, risk assessment at hospitals, the 5 steps like identifying the hazards, deciding about how to control hazards, and how to prevent hazards, and to assess the risks, to make the documentation, and to review the risk assessment. And then finally we have seen about the nosocomial infections, what happens, how it happens, how it can be prevented by taking proper making a proper note of um, components that will prevent infection or cross infection. We also discussed about hospital infection control committee, and what are the principles to reduce the risks in the high risk area, and what is the role of administrators, and what are the universal precautions. And we have also discussed about infection control program. So this was all about your unit 1. So I hope it was clear. And if you don't have any doubts, please let me know. Then I'll give you a 5 minutes break, and then we'll go off to the second unit, which is a very small unit. I'll finish it in 10-15 minutes. So any doubts regarding the first unit, hospital risk? See, everything is very much similar in this. Everything is related to how you prevent an infection to a person who is admitted in the hospital, and what measures you will take to prevent further infections. So this is all about your unit 1. Is it clear so far, or should I repeat any concept?
Clear, ma'am.
Clear? No doubts?
No, ma'am, it was quite clear.
Okay. So then take a 2 minutes break, and then we'll move on to the second unit.
Sure, ma'am.
Sure, ma'am. Thank you.